And as we've been mentioning tonight, the president welcomes Congress back from its August recess with a reminder they have plenty to do on their to-do list. The president will address a joint session of Congress at 8 New York time. He's expected to lay out some specifics on the health care overhaul plan. Melody Barnes joins us now from the White House. She is the president's domestic policy advisor as well as the director of the Office of White House Domestic Policy Counsel. Melody, welcome to Bloomberg News.
It's my pleasure to be here. Thank you.
Is this a make or break event for the president tonight?
Well, it's certainly a very important address, and the president is looking forward to talking to Congress and talking to the American people about where he wants to go in the health care debate in the weeks to come. He certainly wants everyone to walk away from his address tonight understanding a couple of things. One, that this is about security and stability for those who already have health care coverage, to make sure that they can keep their health care coverage and aren't among the 14,000 people who lose their coverage every day. And two, for those who don't have health care coverage, to be able to afford it, which also means that he has to accomplish his third goal of driving the cost of health care down. Those are I think, the key points, the key pillars, and he'll be talking about that and adding more specifics to that this evening.
And we're hearing that the president will strongly endorse the public option, though the question is, does he have the votes in the Senate to get it passed?
Well, what the president has consistently said is that he wants to make sure we have competition and choice in the system. You know, you think about it, if you lived in a town that had one gas station, you wouldn't be so sure that you were getting the best price on gas. I mean, if those of you who are like me, you shop around. He wants to make sure that individuals who are buying in the private market or small businesses that also have to buy have the kind of competition, have the kinds of options available to them to get the most affordable plan.
But Melody, you know you have heard the criticism coming from conservative Republicans. We even played a soundbite of House Minority Leader John Boehner. He says that this is going to lead to a government takeover of the health care system. How do you respond to that charge?
Well, I think that's much ado about nothing. You might remember a couple of days ago, everyone was saying the president's education speech was going to lead to mind control of small children. I mean, we all found out that that wasn't true. This has nothing to do with government takeover of health care. What this has to do with is providing competition and providing choice. I think those are values that we as Americans all ascribe to, and something that the American people are asking for as well.
Well, the other argument from conservatives is also that what's going to happen, a lot of people are going to see that the public option is going to be their best option, and therefore folks are going to flood the public system, which in turn is going to lead to a government takeover of health care reform because private insurers will be put out of business.
No, I think that is absolutely not the case. First of all, in the plans that have already passed through Senate and House committees, we recognize that there's a balancing that will take place. And secondly, this is the kind of competition that people say that they want. I think that this will make the system and the marketplace more competitive, and that people will be able to shop around and find the options that work best for them.
And we're hearing in the address tonight the president will mention medical malpractice litigation, acknowledging that this is a problem. Seems like an effort, though, to reach across the aisle. Do you think it's a problem we'll see addressed in the final version of the bill?
Well, it's something the president has been talking about for quite some time. In fact, if you look at his remarks going back, for several months, he has acknowledged that this is an issue and it's a problem that needs to be addressed. I mean, we'll have to continue to work with Congress to see what will be in the final bill, but it is something that the president has been talking about consistently for quite some time.
Melody, either on both sides of this debate, it seems to have been acknowledged that at some point the White House lost control of this debate. The charges were socialized medicine, death panels, and the like. How did the White House lose control of this health care debate to the point where at some of the town hall meetings we heard some passionate concerns, but some of those concerns became very inflamed? What happened?
Well, one thing I think everyone should understand is while we did see media clips of some town hall meetings, as you described, there were also hundreds of other town hall meetings where people were having reasoned, considered debates. Those didn't always make the news. Secondly, if you look at what's happened in the months since the president started talking about health care, you would have to acknowledge that 4 out of 5 Senate and House committees passing legislation that agree 80% of the time with one another is an advancement that we haven't seen in the 40 years that we've been trying to get health reform done. So I don't think that's losing control of the debate. I think that's moving the ball down the field. And what the president will do tonight is address some of the concerns that are out there, and no one will walk away not clear about where the president stands and why he wants to get this done, and the fact that the American people believe that we have to get this done.
Melody, in about 15 seconds, can the president support a plan that doesn't have a public option?
The president will support a plan that includes competition and choice, and he believes that the public option is one important way to achieve those goals.
Melody Barnes, Director of the White House Domestic Policy Council, joining us this afternoon. Melody, thanks.
Great. Thank you so much.